Okay, hi, my name is Sophia Braden, and I'm interviewing my grandmother, Deborah Braden, and she was a speech pathologist in California for 13 years, Montana for 5 years, and then a program specialist. She supervised speech pathologists for 8 years. And then now she works at Warren Wilson College in Asheville, North Carolina. She has for 13 years, and she's the director of disability services. So, my first question is, what is aphasia?
Okay. Are we going to go again? Okay. Aphasia it's a language disorder that can affect your language processing or your language production. It's generally caused by some kind of damage in your brain.
Yeah, aphasia is a language disorder that affects the comprehension and production of reading, writing, and speech. This disorder is usually acquired through a stroke or other serious brain trauma.
Mm-hmm.
What age demographic is mostly affected by aphasia?
Most stroke patients are generally elderly patients because they're more receptive to strokes. But it can happen at any age if there's some kind of infarct and some kind of accident that would cause a stroke in the brain. So it can happen at any age.
Right. Most cases of aphasia usually occur in older adults. However, individuals of all ages can suffer from it. Statistics show the average age of individuals diagnosed with aphasia is 65.7 years. Right in your age group. And what are common symptoms and different forms of aphasia?
Okay. So there's different forms of aphasia. There's more of the receptive aphasia where it's the person has difficulty processing the language and being able to understand the language. There's more of the expressive aphasia, which is more where the patient has more difficulty formulating sentences, word finding problems. They can't find the right words to say, things like that. You can have a combined of those two also. That's more global, and then yeah.
Right. So there's global aphasia, and global aphasia is the most severe form of it. It can be immediately seen after a patient has a stroke, and people who suffer from this cannot read or write. Mm-hmm. Broca's aphasia is when speech output is limited to a few words. The patient may understand speech, but formulating a response is difficult. These patients can read well, but struggle with writing. And then there's Wernicke's aphasia, and it's referred to as fluent aphasia because patients are able to grasp the meaning of words and understand what has been said to them. During communications, sentences are spoken incorrectly and the wrong vocabulary is often used. Then there is primary progressive aphasia, and it is caused by a neurodegenerative disease. Unlike brain injury or stroke patients, individuals with this form of aphasia suffer from deteriorated brain tissue that help function speech and language. Other mental issues may occur, such as memory loss.
Mm-hmm. That would be more common, like I said, in dementia. As you get older too, that can also be caused because of loss of brain tissue.
Right. And then how is aphasia treated, and what are techniques used to help those suffering from aphasia?
Well, how's it treated? Okay. Generally through speech therapy. Generally the first person who's called in after one of the first people who are called in after a patient comes in and suffers from a stroke is a speech language pathologist who does a full evaluation and kind of gets a baseline of where the patient is at that time, and then decides on the appropriate treatment plan. What other part of that is there?
What are techniques? I think you got that, but speech therapy remains the best source of treatment for patients suffering from aphasia. Within speech therapy, there are multiple techniques that aid retrieval, picture naming, first letter identification, syllable counting, target word identification, and storytelling. And those are some of the best ways to improve speech production.
Right, using sometimes language boards or those kinds of things that are early on.
Right, and then how long does it take an individual with aphasia to recover, and what kinds of hardships do they face?
Okay, so again, it's depending on the severity. It can many times take months for recovery. starting with, generally there's some phase of what's called like more of spontaneous recovery in the first few weeks, and then we kind of see slower progress. So sometimes therapy can last like 6 months to a year or longer, and depending on the age of the patient, the severity of the infarct, and then the assessment on if the patient is making progress. But also the other part, the hardship parts too, are obviously the hardships that come in the independence of the patient, the daily living kinds of things, the family hardships, financial hardships, things like that.
So treatment can help improve the quality of life and revert the consequences of the condition depending on the severity of aphasia and age of the patient. Younger patients usually recover faster, and typically patients must adapt to this condition by learning a new normal for their activities of daily living. Patients who show quick advances in the recovery are usually able to regain independence. Often they can keep their old jobs or get new ones that fit their abilities. For those with severe aphasia, the story is completely different with the quality of life, and it is a lot more restricted. They tend to suffer from depression, social isolation, and loss of independence. Recovery time is different in every patient. Like you said, it can take years, it can take less, take a very long time. If symptoms are not improving after several months, the patient will most likely not be able to fully recover. However, if the patient is showing improvements, even if they are small, then the recovery is plausible. All right, that's all we have.